Welcome to the body imaging cases. This is a 63-year-old lady with histologically proven endometrial carcinoma sent for staging. You are provided with sagittal and transverse T2 weighted images and fused image of the T2 weighted images and the diffusion restriction. On the rest of the images, we have excluded all other stages of the FIGO staging, 2, 3, and 4. And the question here is, what is the FIGO stage of the tumor? Is it 1A or 1B? These are the details of the FIGO staging for the adenocarcinoma of the uterus. And after exclusion of the other stages on the rest of the images, we have here either stage 1A, where the tumor invades less than 1/2 of the myometrium, or stage 1B, where the tumor invades more than 1/2 of the myometrium. This is transvaginal ultrasonography done before the histological diagnosis. The transducer is placed in the posterior fornix, so this is the posterior part of the uterus, and this is the anterior part of the uterus. We see this oblong mass within the uterine cavity. And we see retention of fluid in the rest of the uterine cavity. The ultrasonography image is adjusted here in the same orientation as the sagittal MRI. Between the two examinations, the hysteroscopy and biopsy have been performed and the diagnosis of endometrioid adenocarcinoma obtained. The removed tissue is probably this part here. That's why we see the irregular surface of the tumor at the uterine cavity on MRI done after the hysteroscopy. And it is clear that the tumor is coming from the anterior surface of the uterus. So for the purpose of staging 1A or 1B, we'll be concerned about the relation of the tumor to the anterior myometrium. This is the normal myometrial thickness away from the tumor. And if we look at this part of the uterus here, we can make the stage of 1A because this is definitely less than half of the myometrium. But if we look at this part here, it is completely lost the myometrial thickness. It is located here because the uterus has been stretched by the position of the transducer at the posterior fornix. So we have two assumptions here. Either we are dealing with 1B, that's to say the tumor has invaded almost the whole thickness of the lower uterine segment anteriorly, or we may assume that there has been a cesarean section scar, and that's the reason why the uterine wall is thin at this part, and it is typical of the lower uterine segment caesarean section scar. Through the configuration of the uterine contour here is more in favor of a scar, and is also very well seen here on the transvaginal ultrasonography. But history was missing, and it may sound ridiculous to conclude that this is stage 1A because this is scar, while in fact it is not. We looked into the archive of images of this patient. Probably we may find a clue. We found an old transabdominal ultrasonography 5 years before the present examination, which did not help much if there is a caesarean section scar or not. We found also an MRI done 5 years before the present imaging studies. It was an MRI of the hip joints. So the images that show the uterus were only the transverse T1 weighted images. On this image, we see a very interesting observation: the presence of a lesion which is hyper-intense on T1 weighted images, exactly at the same location of the controversial lower uterine caesarean section scar, which looks typically like endometriosis of the caesarean section scar, intrauterine endometriosis of the caesarean section scar. So if this assumption is true, then we are dealing with endometrial carcinoma arising in endometriosis of a caesarean section scar inside the uterus. To verify, the patient was contacted and admitted having 3 caesarean sections, the last of them 20 years before the present time. So the correct answer to the initial quiz is stage 1A. This part of the uterus is thin, not because the tumor has invaded more than half of its thickness, but because it is a caesarean section scar, and the diagnosis is endometrioid carcinoma arising from caesarean section scar endometriosis, FIGO stage 1A. And the learning point is to illustrate the importance of history taking in modifying the imaging study decision. In this particular case, it could have been stage 1B, endometrial cancer without history of caesarean section, and stage 1A after confirming that this is a lower uterine caesarean section scar. The second important thing is the revision of old imaging studies. And here this shows endometriosis of the caesarean section scar, which was the site of origin of the carcinoma. And this piece of information is present only on this old MRI done for the hip joints, because it will not show itself even on the histopathological examination.